It is very disturbing. And what we're trying to encourage individuals, particularly elderly individuals or anybody who experiences any type of flu-like symptoms, but particularly when it gets to the point where they're having challenges breathing, then they need to seek medical attention urgently as a matter of importance. Contact their doctor, attend at the hospital, et cetera. But if you're having any type of symptoms, but certainly where you're having challenges with your breath, then you need to immediately seek medical attention. We've known previously that, a number of the symptoms related to COVID can be treated with, pain reliever and so forth, over-the-counter types of drugs. But obviously individuals that have perhaps preconditions and other types of mental frailties need to be very, very conscious about any type of symptoms, particularly those that have any type of inhibition as it relates to their breathing, that they need to seek medical attention as soon as possible.
Keeping confidentiality completely in mind, are these mostly elderly patients that are dying at home from these types of issues?
You're right. Too much information obviously could reveal the identity of the individual. So I'm not in a position to discuss that. However, I think of main importance is that anyone, any age, who is experiencing any type of shortness of breath or any issues as it relates to labored breathing needs to seek medical attention immediately.
Are you able to say how many of the deaths roughly are, in a home environment versus in the hospital? Is that a large percentage?
Again, Diane, revealing too much information in a small community such as Bermuda would probably, for fear of us identifying the name of the individual. So we for the privacy of the family and the patient, we can't release that information.
What's the status right now of the vaccination initiative?
We've got over 75% of the population has been vaccinated, and we're seeing a number of doctors' offices as well as pharmacies that have taken up the mantle to continue with the vaccination effort. So we're very much encouraged by that and applauding them for their participation. And we will just continue to utilize the private practices and the pharmacies to provide the vaccinations and the boosters for members of the public.